Yes, how you doing? Okay, oh, is it too far out? It's a little far. Oh, hard, so. There you go. Good. Are we ready? We're good with streaming, so we can start with it. Awesome.
Good to see you. Oh, wait a minute. This looks like a.
Okay. Hi,
Recording in progress.
All set?
Good afternoon, everyone. It's really wonderful to see everyone here for our first JF meeting this year with the Public Health Committee. Welcome. We are in a different room, as has been the case often. Just legislators, if you're coming in and out, the room has 24 seats for legislators, and there are seats behind the testimony desk, I believe, or seats that have been reserved over here to my left. If legislators come in and need a seat, I believe there are also some folks who may not be here in person. So if there are available seats, please feel free to take them. Safety reminder, just that the doors behind us in the event of emergency are the way that we exit. And I will just say that as we begin JFing bills and we move into a different part of the process, I just want to thank my colleagues on the committee, my co-chair and ranking members, for the collaborative way that we've been working together in conversation. This committee has a lot of volume, a lot of issues that are very complex and impact people's day-to-day personal lives. And it's a pleasure to be able to work in that way. and with our amazing staff team behind us. Senator Anwar has been great about making sure we thank them at the end, which I know we will again, but I want to start by saying that I think we'll have some great conversation today about a number of bills. And with that, I'll turn it over to my good co-chair, Senator Anwar, for opening remarks.
Thank you so much, Madam Co-Chair. Just no opening remarks. For the legislators who are questioning why are we reducing the number of seats, it's not on purpose. We are very welcoming as a committee, but the rooms that are getting assigned to us are getting smaller and smaller. I don't know if there is some indication about it, but we'll make it work. Thank you. Welcome, everyone.
Thank you, Senator Summers.
Yes, good afternoon, everyone, and welcome to another exciting meeting of the Public Health Committee. I just wanted to make sure that people understand what's happening today as we vote bills out. There are some bills that will still need tweaking to the language. There will still be changes to some of these bills as they move forward. Some have S language, but it's not perfect yet. So if a senator or a representative votes for something today, the bill absolutely could change. So I just wanted to make sure that everybody is aware of that as we move this forward. And we do have a lot to get through. So I'm looking forward to getting started.
Thank you so much, Senator Summers, and I appreciate you sharing those remarks. I concur. Representative Claritas Gitria.
Thank you, Madam Chair. And to reiterate what Senator Summers said, remember that this language still is a work in progress. So there are many things that we don't like all the time, and we will come to a compromise, hopefully, on most of the things we disagree on. Thank you, Madam Chair.
Thank you, Representative. And yes, we'll keep you in the House with us for sure. I am going to move us on to item number 3 on our agenda, which is proposed bills to be drafted as committee bills. As a reminder, proposed bills that were reserved for subject matter public hearing now must be drafted into legal language. So this is simply a vote to draft the bill, which is different than the next section. So the first item on our agenda to draft is item 1, proposed Senate Bill number 524, an act establishing a pilot program for cardiac screening and early detection of cardiac issues. May I have a motion?
So moved.
Second.
Moved by Senator Anwar and seconded by Representative Claritas Gitria. This bill, the proposed bill, is a bill that in discussion with our colleagues, we are going to move forward with some slightly adjusted language. And I actually, if I may, turn it over to Senator Anwar to talk just a little bit about that. Senator Anwar.
Thank you so much, Madam Co-Chair. I think in the testimonies, what we had heard was that police officers and fire workers, firefighters, they actually are at a higher risk for cardiac events. This bill was triggered by our colleagues, Republican colleagues, who had seen in one of the communities a sudden cardiac death in a firefighter, and that triggered the community to start to see why did that happen when the person was not at just obviously not clearly as much as at a higher risk. And in our conversation, it's very clear that some of the individuals with high stress work may need a little bit more in-depth analysis. And while we were listening to various individuals who spoke about it, we feel it's worthy to get some of the specialists who deal with this in the state of Connecticut to weigh in and look at what can be done to reduce those risk factors or have early identification strategies. And then that's what this bill is going to be about. Rather than having a consultant, we will have our own community members, own specialists, which we have been blessed with some of the finest in the country to be able to weigh in and give us some insight. And I think Senator Summers had also something to add to it.
Thank you, Senator Anwar. Senator Summers.
Yes, thank you, Chair. I think this is a really important bill, and it originally was going to start a pilot program, but we think it's important that we bring our local experts together in a study form to see if this is the right approach. So I'm hoping that the committee will support this as it moves through the process. But this is a good bill that we can all get behind in the fact that it will be looking at our first responders in a much more condensed and with a very fine light on their high risk when it is associated with heart disease. Thank you.
Thank you, Senator Summers. I see there is discussion from Representative Linehan on Zoom. Please proceed, Madam.
Thank you very much, Madam Chair. Just very quickly, when going in and drafting this legislation, I do hope that there is an opportunity to look at heart and hypertension funds on the state level, municipal level, to see if there is a way to ensure that heart and hypertension funds can actually be used not just for paying out when something goes wrong, but also as a way to work with people to keep them healthier and see if we can stop any further tragedy from happening. So those are the gist of my comments, Madam Chair. Thank you very much.
Thank you very much, Representative Linehan. Representative Claridis Tetria.
Thank you, Madam Chair. I'd like to make a motion to start a consent calendar.
We have a motion to start a consent calendar. Is there a second?
Second.
Second, Representative Zupkis. And so item 1, proposed Senate Bill number 524. And hang on 1 second. Do you remember how I talked about our wonderful team who supports us at the beginning? So because these are proposed bills to draft, we actually don't need a consent calendar for these, and we can have a voice vote if there's no objection on item 1. So if there is no objection, seeing and hearing, Representative Linehan, do you have objection, or is your hand raised from earlier? Okay. So
Sorry, ma'am, I didn't lower my hand. I'll do that now. Thanks.
Thank you. So seeing and hearing no objection, those on Zoom, please prepare to vote. We will have a voice vote. All those in favor of drafting proposed Senate Bill number 524, please signify by saying aye.
Aye.
Any opposed? Seeing and hearing none, we will be drafting that bill. Item number 2, proposed House Bill 5902. This is an act requiring food allergy awareness in restaurants. May I have a motion?
So moved.
Moved by Senator Anwar. Is there a second? Seconded by Representative Foster. Was that you? Great. Thank you so much. This bill again is a bill that we propose to draft. The proposed bill that was before us would require the completion of allergen awareness training by restaurant staff. That health department, food inspectors would also complete this training, that there would be records retained for those completion of the training by restaurant and health workers, and that there would be information supplied on restaurant menus, and that all of these things would be posted in restaurants in a clear and conspicuous way. Again, similar to the other bill, we will be working together collaboratively to draft language on this, and I will open this up to discussion. Senator Anwar.
Thank you, Madam Co-Chair. I just wanted to thank Representative Robin Comey for her advocacy for the past many years. It turns out our state is probably one of the last few states in this entire region to have a bill like this, and we are hoping that we will move in the right direction going forward. Many of the states have made these laws after somebody died from anaphylactic shock. And food allergies are real. And I wanted to thank everyone who came to speak, including young children who were talking about how their lives was impacted because they were not able to go to restaurants and they did not have appropriate information. We feel it's worthy. It's time for everybody to come together. And I think the implementation and that conversation we can have with our friends with the Restaurant Association, but we do need to make sure that we make restaurants a safe place for everyone. Thank you, Madam Chair.
Thank you, Senator Anwar. Senator Summers.
Yes, although this is an important bill, I will remind everyone that the DPH commissioner testified against this bill. We have been working for years to come in line with the new guidelines by the FDA, which they are almost completed. And once those are initiated and adopted, it will take care of the things that you're seeing in this bill. So I'm going to be a no today to flag this. And again, so people are aware the DPH commissioner did vote and testify against this bill. And I think
Thank you.
Representative Zupkis.
Yep. Thank you, Senator Summers. Representative Zupkis.
I'll just say ditto. That's what I was going to say. Thank you.
Thank you. I appreciate that. Is there any further comment? Representative Foster.
I appreciate the opportunity to see this bill drafted. As this bill was getting a public hearing and a lot of local constituents were talking and sending messages about it, I had a few local restaurants who are all stars on managing allergy awareness, saying that they would be amenable to different education from the local health department if that was available, but they would like to know what the actual language is going to look like to better understand how it might impact their business model. And I think this conversation is really beneficial to have as a parent who's teaching a 4-year-old to do allergy advocacy for herself for times that she's not with her parents. It's an uncomfortable, nerve-wracking experience for parents to have opportunities where your child might be eating out with another adult who might not elevate allergen awareness as strongly as you'd advocate for it yourself, who might not be able to discern whether or not restaurant staff are taking allergen concerns seriously. I feel like I've learned the signs of someone who's not truly committed to saying that they're actually going to handle an allergen in a restaurant, and I can sort of read the room a little bit better. And so I've not really trusted anyone to take my child to a restaurant. And so I have a lot of compassion for the families who testified, and am eager to hear what restaurants would say, having read more language. Hopeful, as Senator Summers says, that there might be resolution, but I'm eager to hear what restaurants will say when they can see drafted language. So thank you very much.
Thank you very much, Representative Foster. And again, this is a vote to draft, which means we will not have another hearing on the bill. However, if it would end up on an agenda today off, there would be additional discussion that would be based on that. Representative Claritas Deetria.
Thank you, Madam Chair. I ask when this vote be taken, it be taken by roll.
Thank you, Representative. Seeing and hearing no further discussion or comment, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vahey,
Representative McCarthy Vahey votes yes.
Senator Kushner, Senator Marks,
Senator Marks votes yes.
Representative Parker,
Representative Parker votes yes.
Senator Summers,
Senator Summers votes no to flag this bill.
Representative Claritas Deetria,
Representative Claritas Deetria votes no to flag this bill.
Representative Berger Givallo,
Rep. Berger Givallo votes yes.
Senator Cabrera,
Senator Cabrera votes yes.
Representative Carpino,
Representative Carpino votes yes.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné,
Rep. Dauphiné votes no.
Rep. DiCaprio,
Representative DiCaprio votes yes.
Representative D'Amico,
Representative D'Amico votes yes.
Representative Denning,
Representative Denning votes yes.
Representative Elliott, Representative Foster,
Rep. Foster votes yes.
Representative Jenga,
Representative Jenga votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Gordon,
Senator Gordon votes yes.
Representative Cabras DeGraw, Representative Kidd,
Representative Kidd votes yes.
Representative Kennedy,
Kennedy votes yes.
Representative Lenahan,
Representative Linehan votes yes.
Representative Mara,
Representative Mara votes yes.
Representative McCarthy, Representative Palm,
Palm votes yes.
Representative Perillo,
Perillo votes no.
Representative Rader,
Representative Rader votes yes.
Senator Rahman, Representative Reddington Hughes,
Representative Reddington Hughes votes no to flag this bill.
Representative Ryan,
Representative Ryan votes yes.
Senator Slack, Representative Steinberg,
Representative Steinberg votes yes to not flag this bill.
Representative Terciak, Representative Waylander,
Representative Welander votes yes.
Representative Zupkis,
Representative Zupkis votes no to flag this bill.
thank you, Madam Chair.
Oh, thank you so much, Madam Administrator. We will be holding votes open. I will announce the time once I communicate via text with our team and a couple of folks, just to make sure that everyone has the opportunity to vote today. So next on our agenda, we are moving into section number 4, bills to be considered for JF action. The first item is item 2, Senate Bill number 919, an act establishing a task force to study childhood and adult psychosis. The action is a JFS to the floor with an LCO of 5072. May I have a motion?
So moved.
Moved by Senator Amor. Is there a second?
Second.
Seconded by Representative Berger Gervalo. The item before us, the S language really just fleshes out membership of the 10-member task force that is being established to study childhood and adult psychosis. It will establish clinics staffed by, it will examine the establishment of clinics staffed by various mental health professionals, early evaluation of individuals with psychosis symptoms, creating care pathways, strengthening existing clinical networks, and it must report to the Public Health Committee by January 1st, 2024. Again, the S language simply adds that membership to it and fleshes it out. Is there discussion on this item? Senator Amor, to be followed by Senator Summers.
Thank you so much, Madam Chair. This is an important bill. As many of you may recall, in the last session, we had Senate Bill 1, Senate Bill 2, and House Bill 5001, which was looking at a comprehensive strategy of taking care of the children's mental health. One of the areas that we have not gone deep into in the previous bills was the childhood psychosis. I'm using the word childhood psychosis, but in reality, sometimes the first episode of psychosis may be at the age of 17 or 18. And thankfully, in our state, in collaboration with Yale University as well as Demas, they have done some amazing work, which is published and recognized across the country and beyond, where after the first episode of psychosis, you can have put in a comprehensive team to be able to address the needs of the individual and be able to change the trajectory of their life. That would really be very meaningful. There are hundreds of children and adults who actually get the first episode. And then once there is a comprehensive network that is available to address that, we can actually have them be able to live to their full potential. Because of the existing work and the work Demas has done, we are moving in the direction that we need to have a comprehensive plan that the state will spread this across the entire state. And that's what this is going to be the starting point. And we hope that people will recognize and be able to support this bill so that we can take care of all of our children who have psychosis, which is, well, I'll use the words children, but adults as well who have psychosis, and we need to be able to help them out. And the change that we have made is after conversation with Hartford Hospital, they have their plan, and we want to collaborate and get the larger institutions who've been working on this together. So thank you, Madam Chair, for allowing me to explain this. Thank you.
Thank you, Senator Amor. Senator Summers.
Yes, just for point of clarification, number 1 on the list, SB 899, for people in the audience, are we holding that bill?
That bill will not be taken up. We're on item number 2.
Right, but it's on the agenda, so
Right.
are we holding that bill?
We are not taking action on item number 1
Okay, just for
today.
people that are here today, I think it's important that we recognize that and address it. Thank you.
Thank you. Is there further discussion on item number 2? Representative Clara DeStitria.
Thank you, Madam Chair. I ask when this vote is taken, that it be taken by roll.
Thank you, Representative. Seeing and hearing no, oh. Nope, seeing and hearing no further discussion. Right? Anyone else? Okay, seeing and hearing none, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vey,
Representative McCarthy Vahey votes yes.
Senator Kushner. Senator Marks,
Senator Marks votes yes.
Representative Parker,
Representative Parker votes yes.
Senator Summers,
Senator Summers votes yes.
Representative Clara Destetria,
Representative Clarice Deetria votes yes.
Representative Burger Javalo,
Representative Burger Javalo votes yes.
Senator Cabrera,
Senator Cabrera votes yes.
Representative Carpino,
Representative Carpino votes yes.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné,
Rep. Dauphiné votes no.
Representative DiCaprio,
Representative DiCaprio votes yes.
Representative D'Amico,
D'Amico votes yes.
Representative Denning,
Representative Denning votes yes.
Representative Elliott, Representative Foster,
Rep. Foster votes yes.
Representative Jenga,
Representative Jenga votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Gordon,
Senator Gordon votes yes.
Representative Cabras DeGraw, Representative Kidd,
Representative Kitt votes yes.
Representative Kennedy,
Kennedy votes yes.
Representative Lenahan,
Representative Linehan votes yes. Sorry for the delay, madam.
thank you. Representative Mara,
Representative Mara votes yes.
Representative McCarthy, Representative Palm,
Palm votes yes.
Representative Perillo,
Perillo votes no.
Representative Radar,
Representative Rader votes yes.
Senator Rahman, Representative Reddington Hughes,
Reddington Hughes votes yes.
Representative Ryan,
Representative Ryan votes yes.
Senator Slack, Representative Steinberg,
Representative Steinberg votes yes.
Representative Terciak, Representative Welander,
Representative Welander votes yes.
Representative Zupkis,
Representative Zupkis votes no, because I think some of this already happened. So once I get my resources together, I might change it on the floor, but for now, a no.
thank you, Madam Chair.
Thank you, Madam Administrator. Moving on to item number 3 on the agenda, Senate Bill number 956. This is an act requiring discharge standards regarding follow-up appointments and prescription medications for patients being discharged from a hospital or nursing home facility. This is a JF to the floor. May I have a motion?
So moved.
Second.
Moved by Senator Summers and seconded by Senator Anwar. This bill will likely need a little bit more conversation. We've heard from GCP to make sure that we ask for some conformance changes. But the bill requires that the discharge plans include the date and location of follow-up medical appointments, a list of medications the patient is taking and will continue to take after discharge. And when a hospital or nursing home discharges a patient to home, his or her home, it requires the facility to transmit the patient's pharmacy to transmit to the patient's pharmacy, and that each prescription, including each prescription ordered for the patient. Is there discussion on this item? Senator Anwar and I believe Representative Carpino.
Thank you so much, Madam Co-Chair. So I wanted to thank Senator Marks for bringing this bill to our attention in the committee. We talk about the concept of transition of care. Anytime a patient is moved from one floor to the next or moved from the hospital inpatient to an outpatient setting, that is the high risk time when the medication error can increase. And it's important to have a timeout and make sure that we go through the checklist of every medicine is accounted for, the dosage is accounted for, and there's a clear communication at that point. Another point of transition is when a person is discharged from a rehab facility and they move to home or get the visiting nurses be at home. That is another point that we need to make sure that the information of the discharge instruction is clearly highlighted, and that's another risk area. So I think looking at this, and then we may need to make a few tweaks, but the bill is a good bill and is much needed, and it will help reduce the risk of errors and will benefit our patients' community. So, Madam Chair, it's a good bill. It ought to pass. Thank you.
Thank you, Senator Anwar. Representative Carpino.
Thank you, ma'am. I agree with the good chairman that it is a good bill, but I also agree with you in that it needs some further conversation. I do have concerns with the medication list and agree with the intent, but knowing that if somebody is in the hospital for just a couple of days, I find it difficult to require and hold legally accountable a hospital for information they may not have access to. So if a patient is not a good historian, or perhaps the family is not aware of all of the medications and doesn't let the hospital know, and again, knowing that a short stay might be very different than a lengthy discharge and transition, I just think it needs further clarification as this moves forward. So I hope that we're going to continue that conversation. I will give you, ma'am, the benefit of the doubt and vote for this today, but do hope that we really look at that, because I agree with the concept and agree that we want to give a patient the best chance of not being readmitted. But I truly think we need to look at the information available to somebody before we hold them accountable. Thank you, ma'am.
Thank you, Representative. And yes, we did hear some testimony to that effect when we heard the bill earlier. Is there further comments? Oh, Senator Gordon.
Thank you, Madam Chair. I just want to echo what both of my colleagues said very well. I can tell you I take care of patients every day who leave a hospital somewhere, and it can be very difficult to figure out what their discharge planning is, separate from the fact there is Joint Commission national accreditation of hospitals that does have standards about this stuff. So I do agree that it's very important and extremely important for the well-being and even the safety of our patients and people in the state who leave this hospital or a nursing home. But I also agree we should delve further into it and better understand that if a hospital has someone under their care, inpatient, and they have no idea a patient's on a certain medication, patient family doesn't say it whatsoever, they should not be held liable for that. Medicines that they change or medicines they specifically say they want to continue or stop, yes, there is that liability, and that transition of care is extremely important. So I will support moving this bill forward, and I look forward to some further tweaks and changes to address the issues that have been raised. Thank you, Madam Chair.
Thank you. I'm going to go to Senator Summers and then Senator Marks on Zoom.
Yes, this is an important bill for patient safety. I will say that the Hospital Association has sent us all, I believe the leaders, some tweaks to the language after line 37, which indicates, I believe it says, quote, to the best of the hospital's knowledge, end quote. That should help with the liability aspect. So as we said, there are some language tweaks that are needed, but those were the only comments that we have received from the Hospital Association. And I wanted to make sure that that got on the record. Thank you.
Thank you, Senator Summers. Senator Marks.
Thank you, Chair. Through you, just as was stated with testimony for this bill, when you go into the hospital, especially with electronic medical records now, all of the medications that you are taking at home does get transcribed onto your med list. It's what I do every day of my life, and patients, every single medication a patient is taking does get put onto that hospital medication list. I mean, if you kind of think about it, you wouldn't not take take a medication when you're in the hospital. So it isn't by what family says. It is actually transcribed through electronic medical records. And that was the pharmacist that came and testified did also state that. Thank you for your letting me speak.
Thank you, Senator Marks. Seeing no further comments or questions, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vahey,
Representative McCarthy Vahey votes yes.
Senator Kushner, Senator Mark,
Senator Marks votes yes.
Representative Parker,
Representative Parker votes yes.
Senator Summers,
Senator Summers votes yes.
Representative Clara DeStitria,
Representative Claire DeStitria votes yes.
Representative Berger Givallo,
Rep. Berger Givallo votes yes.
Senator Cabrera,
Senator Cabrera votes yes.
Representative Carpino,
Representative Carpino votes yes.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné,
Representative Dauphiné votes yes.
Representative DiCaprio,
Representative DiCaprio votes yes.
Representative D'Amico,
D'Amico votes yes.
Representative Denny,
Representative Denning votes yes.
Representative Elliott, Representative Foster,
Rep. Foster votes yes.
Representative Jenga,
Representative Jenga votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Gordon,
Senator Gordon votes yes.
Representative Cabris DeGraw, Representative Kidd,
Representative Kitt votes yes.
Representative Kennedy,
Kennedy votes yes.
Representative Lenahan,
Linehan votes yes.
Representative Morrow,
Representative Mara votes yes.
Representative McCarthy, Representative Palm, Representative Perello,
Perillo votes yes.
Representative Rader,
Representative Rader votes yes.
Senator Rahman, Representative Reddington Hughes,
Representative Reddington Hughes with tweaks votes yes.
Representative Ryan,
Representative Ryan votes yes.
Senator Slack, Representative Steinberg,
Representative Steinberg votes yes without any other further comments about the further needs of this bill.
Representative Terziak, Representative Welander,
Representative Welander votes yes.
Representative Zupkis.
Representative Zupkis votes yes.
Thank you, Madam Chair.
Thank you, Madam Administrator. Who misses Rep. Steinberg as the chair, huh?
Excuse me, can I cast my vote now?
Madam Administrator, Senator Kushner is here.
Senator Kushner votes yes. Thank you.
Thank you, Senator Kushner. Okay, moving on to item number 4 on our agenda, Senate Bill number 957. This is an act concerning the oversight of healthcare in correctional institutions by the Department of Public Health. This is a JF to the floor. May I have a motion?
So moved.
Second.
Moved by Senator Anwar and seconded by Senator Summers. This bill establishes within DPH an Office of Oversight of Healthcare in Correctional Institutions. That office would be responsible for implementing the plan that was developed under last year's legislation. It would conduct periodic inspections, issue notice of failure, And the new office would develop a model plan by January 1st, 2025. Is there discussion on this item? Representative Zupkis.
Thank you. I'll be quick. Thank you, Madam Chair. I'm going to support this bill. My question, though, is do we have any idea of a fiscal note and how many people they would have to hire to create this department?
Thank you for that question, Representative Zupkis, and I'll be quick in my answer, no. And it's a very valid question and certainly one that will require more conversation with the department, both with the Department of Public Health and with the Department of Corrections, conversations which will be continuing to happen throughout the session, but it's a valid question. Are there other comments or questions on this bill? Representative Clara DeStitria.
Thank you, Madam Chair. I'd like to put this item on consent calendar, please.
Wonderful. Are you making a motion?
I'm making a motion to put this item on the consent calendar.
Wonderful.
Thank
We
you,
have a
Madam Chair.
motion for consent calendar by Representative Clara DeStitria, and I saw a second down there. Was that you, Representative DiCaprio? I wasn't sure if that was you or Senator Gordon. So seconded by Representative DiCaprio. We will begin a consent calendar. This item will be the first item on our consent calendar, hopefully the first of many. And so with that, we will move on to item number 5 on our agenda, Senate Bill number 958. This is an act concerning the timely transfer of medical records between healthcare institutions. This is a JFS to the floor, LCO number 5405. May I have a motion?
Second.
Moved by Representative Clara DeStitria and seconded by Senator Summers. This bill, the S language, well, first of all, the changes in the current language that we had went from 24 hours to 2 business days in a non-urgent request. In addition, we have S language that relates specifically to, hang on one second, to limiting health records fees. And the limit would apply to not just providers, but to other parties who would be in possession of the patient's medical records. Is there discussion on this item? Representative Clara DeStitria.
Madam Chair, I make a motion to put this item on the consent calendar.
Thank you. And we're good once Representative Clara DeStitria said without objection, since we have a consent calendar going, we're good. So seeing no objection, this item, number 5, Senate Bill 958 will be added to our consent calendar. We're going to move on to item number 6, Senate Bill 959, an act establishing a mold protection advisory council to recommend protections for residents of residential property from mold infestation. This is a JFS to the floor with LCO number 5183. Is there a motion?
So moved.
Moved by Senator Summers and seconded by, I believe, was that Representative Dauphiné or Representative Kennedy? Thank you. Seconded by Representative Kennedy. So this actually S language will move this from an advisory council to requiring that DPH take action by January 1st, 2024 to evaluate the information and guidance from the EPA to develop uniform standards for identifying and assessing molds in residential housing, to develop guidelines for limiting mold exposure, and for publishing these standards and developing a public awareness campaign. Is there discussion on this item? Seeing and hearing none, Representative Clara DeStitria.
Madam Chair, I'd like to put this on the consent calendar.
If there is no objection, item number 6, Senate Bill 958 will go on, item number 6, Senate Bill 959 will go on our consent calendar. With that, we'll move to item 7 on our agenda, Senate Bill 960, an act establishing a working group to evaluate emergency department crowding. This is a JFS to the floor, LCO number 5165. Moved by Senator Anwar and seconded by Senator Summers. The evaluation bill, the JFS language, similar to our other bill, really fleshes out the membership with more specifics on who the membership would be on this advisory group. The group would advise on establishing quality measures for timelines of transfers of ER patients, establishing discharge units to expedite the discharge, and liability reductions for hospitals and their physicians when ER crowding causes significant wait times. And again, the S language puts forth who those members would be. Is there discussion on this item before us? Seeing and hearing none, Representative Clara DeStitria.
Madam Chair, I'd like to put this item on consent.
With no objection, seeing and hearing no objection, item number 7, Senate Bill 960 will be moved to our consent calendar. Next on our agenda is item number 8, House Bill number 6562, an act concerning telehealth. This is a JF to the floor. May I have a motion?
So move.
Moved by Senator Anwar. There's seconded by Senator Summers. And this bill, just a couple things about this bill. That one, clarifying some confusion, the audio only will be allowed by this bill. That was a question in testimony indefinitely. It will authorize providers to provide telehealth services from any location, which of course is subject to applicable state and federal requirements. And it will prohibit charging under or uninsured patients more than Medicaid reimbursement rates. There are a few other provisions, but I know that there is some discussion on this. Before we go to discussion, I will note that we expect that this will be ongoing conversation. Human Services has a bill. We've heard today in particular from a number of providers who have some concerns about the language. So this is something that we know has been a very important thing for the people of our state. We had special act language, which sometimes means when we convert special act to public act, that can be complicated in drafting language. So we know we're going to work together to make sure we address some of those concerns. And I'm going to turn it over to Senator Anwar and then Rep. Clara DeStitria.
Thank you so much, Madam Co-Chair. This is a good bill. This is going to help address some of the issues. It's going to take care of the sunset provision that was in the previous bills. It is going to have the voice only option as well. It does need a little bit of a tweaking with respect to out of state clinicians who are going to call our state who may not have Connecticut licensure. So we want to tweak some of that language around that. So I think we should pass this bill with the understanding that this will be amended later on the floor with some of the other concerns that people have raised. So we will address some of the changes which will be needed, but majority of the things in this bill are pretty much ready. The others we will work on. Thank you, Madam Chair.
Thank you, Senator Anwar. Representative Clara DeStitria.
Thank you, Madam Chair. And I just like to echo my colleagues. I do think this is an important piece of legislation. And just to make people understand out there that the out-of-state telehealth providers have to verify their credentials as providers, that they're in good standing and they have liability insurance and whatnot. And that will be another check and balance that I think is important, but I hope we're able to tweak this a little bit more and get it so everybody is completely happy with it. Thank you, Madam Chair.
Thank you, Representative. Senator Gordon.
Thank you, Madam Chair. I think there are some good provisions in this bill. I can't support the bill as it's written now, and I do hope there is some changes. My major concern is that we would have people, doctors, for example, providing care in other states. Granted, they may be licensed in their states and meet their standards, but they're not licensed in Connecticut. And I think that is lacking if we're going to be talking about telehealth, that we need to address that they should be licensed. It's not difficult to get licensed in this state. And even if you're in another state, you can get licensed here. I'm licensed as a doctor in more than one state, for example. But that way they're licensed here, they've met our criteria, but also in case of any oversight that might be needed. I think that's extremely important for patient safety when we're talking about patient care, especially if we're going to start doing it for people who aren't actually here in this state. That does raise a concern. And the concern also, if they're not licensed here, is how we're now fragmenting care, which is a real concern already. And I know we're trying to address that with some other bills with records being sent and other things like that. But I don't think this would send it in a good direction. And I would hope that we could work on wording to address those serious concerns. Thank you, Madam Chair.
Thank you for that, Senator Gordon. And certainly one of the big conversations that we will have in a number of bills this session is balancing expanding care and opportunity for people to be cared for while assuring that they have quality and safe care. And so we will continue the conversation on this bill. Is there any further discussion on, oh, Representative Kennedy, please proceed. Madam.
Thank you, Madam Chair. And I too, excuse me, have concerns with some of the language in the bill as currently written, but I will be supporting it today with the assurances that changes will be made, and I look forward to seeing that new language. Thank you, Madam Chair.
Thank you, Representative. Seeing and hearing no further discussion, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vahey,
Representative McCarthy Vahey votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Marks,
Senator Marks votes yes.
Representative Parker,
Representative Parker votes yes.
Senator Summers,
Senator Summers votes yes.
Representative Claudia Dietrich,
Representative Claire Distria votes yes.
Representative Berger Givallo,
Rep. Berger Gervallo votes yes.
Senator Cabrera,
Senator Cabrera votes yes.
Representative Carpino,
Representative Carpino votes yes.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné,
Rep. Dauphiné votes no.
Representative DiCaprio,
Representative DiCaprio votes no to flag the bill.
Representative D'Amico,
D'Amico votes yes.
Representative Denning,
Representative Denning votes yes.
Representative Elliott, Representative Foster, Representative Django,
Representative Jenga votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Gordon,
Senator Gordon votes no to flag it.
Representative Cabras DeGraw, Representative Kitt,
Representative Kitt votes yes.
Representative Kennedy,
Kennedy votes yes.
Representative Lenahan,
Linehan,
I did not hear you, Representative Lenahan.
thank you. There it goes, Madam. Representative Linehan votes yes.
Thank you.
Thank you.
Representative Morrow,
Representative Mara votes yes.
Representative McCarthy,
Representative McCarty votes yes.
Representative Palm, Representative Perrello,
Perillo votes yes.
Representative Rader,
Representative Rader votes yes.
Senator Rahman, Representative Reddington Hughes,
Representative Reddington Hughes votes no to flag the bill.
Representative Ryan,
Representative Ryan votes yes.
Senator Slack, Representative Steinberg,
Representative Steinberg votes yes.
Representative Terziak, Representative Waylander,
Representative Welander votes yes.
Representative Zupkis.
Representative Zupkis votes yes.
Thank you, Madam Chair.
Thank you, Madam Administrator. Moving on, we are going to item number 9 on our agenda, which is House Bill number 6599, an act concerning intimate partner violence and other domestic violence. This is a JFS to the floor with LCO number 5075. May I have a motion?
So move.
Moved by Senator Anwar, seconded by Senator Summers. This bill has S language that makes some slight changes related to the educational materials to be developed by the Maternal Mortality Review Committee, materials regarding intimate partner violence, specifically towards pregnant and postpartum persons. And those would be for the Department of Public Health to distribute and to birthing hospitals in the state and to OBs and other healthcare providers. And it would also, the bill also allows for reporting by those providers who do actually provide this information to their patients. Is there discussion on this item? I will say one other thing. I just want to thank CCADV and all of the advocates for their help with this. And I think Rep. Clara DeCitria, you were about to. say
Thank you,
something.
Madam Chair. I asked this item be put on consent.
Seeing and hearing no objection, item number 9, House Bill number 6599 will be moved to our consent calendar. Moving on to item number 10, which is House Bill number 6600, an act concerning funding for regional behavioral health action organizations. This is a JFS to appropriations with an LCO 5334. May I have a motion?
So move.
Moved by Senator Anwar and seconded by Representative McCarty, the person who I sometimes get mistaken for, and I'm happy to be mistaken for her. I will say that this bill, the Regional Behavioral Health Action Organizations, some might recall that many years ago, the Regional Action Councils and the Regional Mental Health Boards were combined. And this bill, actually the JFS language would be to provide funding $200,000 to each of the 5 regional behavioral health organizations. The original language was $200,000 in total. Is there discussion on this item? Representative D'Amico.
Thank you, Madam Chair. And I certainly appreciate the fact that has been corrected in the substitute language and that it's going to be a total of, I believe it's $1 million. Do I have that right? 200,000 times 5, which is great. So I just wanted to bring up one thing. So we saw some testimony from the Keep the Promise Coalition regarding the catchment area councils that you just referred to. So I guess the concern is that the catchment area councils have not been given adequate support by the regional behavioral health action organizations. So, and the suggestion was made that we should amend Section 17A-484 of the Connecticut General Statutes to require the RBHAOs to support the catchment area councils. And I don't want to start a big ruckus today, but I am going to trust that you will make an effort as this bill goes forward to try to honor that request.
Thank you very much for that, Representative D'Amico. The catchment area councils, which primarily are formerly our mental health boards had worked with, really are the voice of consumers and providers who are receiving services throughout the state. And we know that mental health is an issue that we have talked about so extensively, and it's one we need to continue talking about. These are the folks who actually help us to assure that we have these conversations moving forward. So I'm going to go next to Representative McCarty.
Thank you very much, Madam Chair, and I really do appreciate your remarks. The great work that the regional behavioral health organizations are doing currently, and we've put an awful lot of new mandates on them. They're doing in the community, they're engaging the community now with trauma training for the community and other areas. But I also agree with Representative D'Amico. Some of the regional behavioral health organizations do have individuals with lived experience on them. And I think we do need to keep an eye on that. But I wanted to give a shout out to them because of the great amount of work they're doing with suicide prevention, gambling, all those areas, and we keep putting more on them. So thank you for your comments.
Thank you very much, Representative McCarty. And really to loop back with both of you, the catchment area councils, certainly the regional suicide advisory boards are now part of their work. There's Narcan training, there's trauma training, there is prevention and sustainability for our local prevention councils. So this is all some of the work that they're doing. And I very much appreciate those remarks and look forward to continued conversations to make sure that we can get them the funding and support that they need so that they can help provide support to the residents of our state. So if I am seeing no further discussion, Representative Clara DeCitria.
Madam Chair, I'd like to put this item on consent.
Seeing no objection, hearing no objection, item number 10, House Bill number 6600 will be moved to our consent calendar. Next item on our agenda is item 11, House Bill number 6601, an act declaring homelessness a public health crisis. This is a JF to the floor. May I have a motion?
So move.
Moved by Senator Anwar. Is there a second? Seconded by Representative Gilchrist. This bill is a chance for us to declare homelessness the public health crisis that it is. I think some have questioned, why do we need to say this? And why is this important? And I think we had really great testimony from Sarah Fox of CCEH, who talked about the fact that sometimes simply naming this will help us to align resources and to collaborate among agencies. This bill will not provide funding. This bill does make changes to the Homeless Person's Bill of Rights to specify that a person has the right to receive mental health care services, as well as essential medical services. But it will not provide the kind of funding that is needed to address the issues of housing and homelessness around our state. That work will be done in other committees. But the sense of knowing how important it is for us as the Public Health Committee to understand and name clearly the role of housing and health, and how clearly housing is as a social determinant of health. So with that, is there discussion on this item? Senator Anwar, followed by Senator Summers.
Thank you so much, Madam Chair. This is very real, and during the winter months, it becomes even more real. First of all, because of the number of evictions that are happening in our state, and also the financial challenges that people find themselves in, homelessness is increasing. And we also need to recognize that homelessness leads to individual nowadays we're seeing hypothermia, where their body temperatures are very low, and they come to the emergency rooms, and some people don't make it. They get heart arrhythmias, and these are individuals who are experiencing homelessness sometimes because of financial issues or substance use issues or underlying mental health issues, which are all treatable. And that's what the hope is, that we actually raise that awareness. The healthcare systems end up paying a whole lot. The care for one person in the intensive care unit for 3 days, that's where they end up in the ICU, would pay for their rental for the whole year, just for the time that they're in the ICU. We need to start to raise that awareness to actually make sure that we all develop partnerships to be able to look at this in a much more comprehensive manner. And there is a mindset at times in a small segment of population that people become homeless of their own choice. I would encourage them to interact with people who are homeless, to know that nobody makes a choice to be homeless. It happens in unfortunate circumstances. I do feel it's important to start to raise the awareness on the public health end, and then we can actually start to look at it comprehensively through other committees as well. And that work is happening as we speak. Thank you so much, Madam Chair.
Thank you, Senator Summers.
Yes, thank you, Madam Chair. I think it's important for people watching that declaring homelessness a public health crisis does not have the same level as if when the governor declares a public health an emergency crisis here in the state of Connecticut. It will bring an awareness to the situation. Homelessness has been chronic. It is a significant issue in our state, and it is growing. I will, however, disagree with my good co-chair. There have been people that I have met personally that they choose to be homeless because they're suffering from mental health disorders. We see that chronically with our veterans, and that's something that we need to address here in the state of Connecticut. I have some concerns with some of the way the language is written, but I'm going to vote yes for this because I think it's a very important statement and a focus that our state needs to consider. We increase our homelessness. I remember 10 years ago going to an award where someone received an award for ending homelessness. And here we are now in the state of Connecticut seeing it increase. So I do think that this is something that the Public Health Committee definitely needs to look at. And I will work on some of the language tweaks that I think that this bill needs going forward, but I am going to support this today. Thank you.
Thank you, Senator Summers. And you certainly underscore those mental and behavioral and physical health issues that are at issue for so many of the people who we know are experiencing homelessness. Representative Zupkis.
Thank you, Madam Chair. And I am going to be a yes on this. I agree with what Senator Summers says, and I'm also curious, essential to some is different from essential to others. So I hope essential is really kind of thought through and defined a little bit more, because there's a very big difference in emergency and essential. Because everybody defines that differently. So I hope there is thought put into that. I am very familiar with homelessness. I do believe that there are a lot of services that are out there. I know anyone can walk into a hospital and get taken care of. I know that we have so many things out there, and people have to want to take advantage of that. So I just wanted to say that, but also wanted to make sure that we're clear on what essential means.
I appreciate that, Representative Zupkis. Representative Clara DeStitria.
Thank you, Madam Chair. I will be supporting this bill today. I think it's important to help our homeless population, because we know a lot of our homeless residents in Connecticut have mental health issues, and that's the buzzword that we talk about constantly in Connecticut. So what's the why they're homeless? And if they say they want to be homeless, I truly don't believe people want to be homeless. It's their mental health. That's the problem. That's keeping them from doing the right thing, from going to the hospital, from going to a shelter. So those are the things we have to address. So I hope this bill is, again, a work in progress, and we could move it forward with all the things that we think will help the residents of Connecticut in the best way possible. Thank you, Madam Chair.
Thank you. Senator Gordon.
Thank you, Madam Chair. I do agree that dealing with homelessness is very important, just not medical, but also mental health care. I do want to raise what's already been raised, the concern that if we are putting in the word essential and do not have it defined at this time, that is a serious lacking, because if we're going to say what essential is, essential can be anything to anybody, anytime, based upon whatever they feel subjectively, just not objectively. So I want to caution that if we're going to use the word essential, and I look forward to seeing how this committee defines that, because that's very different from emergency. What exactly that's going to commit the state to? Because if we're saying that each homeless person in this state has the right to, and I'm not going to read through all of the bullet items, but we include essential medical and mental health care, we really need to define that and be very clear, because it will have a ramification as far as what the state might be committed to, or other committees feel it will be committed to. But also there is a cost, and we would want to make certain that if we do feel this is something to do, the state has the resources to do it. So I just want to caution about that. Thank you, Madam Chair.
Thank you, Senator Gordon. Is there any further discussion on this, Representative Kennedy?
Thank you, Madam Chair, and I don't want to belabor this, but this is just such a big issue, the issue of homelessness. You know, it's sad that it's back on the increase when at one time it was decreasing, but it's almost doubled now at this point. I too will be supporting this bill, but I do have some concerns with the language, as been stated by a lot of my colleagues. I do have concern with the word essential, and hope that'll be spelled out, and we'll work the language out as we move forward. But I will be a yes today on this very, very sensitive and issue that we're dealing with. So thank you very much, Madam Chair.
Thank you. I think we all are recognizing that it is essential that we have the conversation. And essential is an important word to define, but I appreciate this conversation. This is one of the biggest topics that will be addressed in the General Assembly this year from many different committees, the issue of homelessness, housing, and health. So I appreciate the conversation today, and seeing no further discussion on the item, Madam Administrator, would you kindly call the roll?
Senator Anwar,
I will essentially vote yes.
Representative McCarthy Vahey,
Representative McCarthy Vahey votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Marks,
Marks votes yes.
Representative Parker,
Representative Parker votes yes.
Senator Summers,
Senator Summers votes yes.
Representative Clara DeStitria,
Representative Claire DeStitria votes yes.
Representative Burgess Zavala,
Representative Berger Javala votes yes.
Senator Cabrera,
Senator Cabrera votes yes.
Representative Carpino,
Representative Carpino votes yes.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné,
Rep. Dauphiné votes no, and I look forward to seeing what essential means. Thank you.
Representative DiCaprio,
Representative DiCaprio is essentially a yes. Thank you.
Representative D'Amico,
D'Amico votes yes.
Representative Denning,
Representative Denning votes yes.
Representative Elliott, Representative Foster, Representative Jenga,
Representative Jenga votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Gordon,
Senator Gordon votes yes at this time, so I can learn more about what essential is going to be defined as.
Representative Cavros DeGraw,
Gavros DeGraw votes yes.
Representative Kidd,
Representative Kitt votes yes.
Representative Kennedy,
Kennedy votes yes.
Representative Lenahan,
Linehan votes yes.
Representative Morrow,
Representative Mara votes yes.
Representative McCarthy,
Representative McCarty votes yes.
Representative Palm, Representative Perello,
Perillo votes yes.
Representative Rader, Senator Rahman.
Representative Rader votes yes. I'm sorry.
That's
Thank you.
okay. Senator Rahman, Representative Reddington Hughes,
Representative Reddington Hughes with a definition of essential votes yes.
Representative Ryan,
Representative Ryan votes yes.
Senator Slack, Representative Steinberg,
Representative Steinberg, who knows the meaning of essential, votes yes.
Representative Terciak, Representative Wielander,
Representative Wielander votes yes.
Representative Zupkis.
Representative Zupkis votes yes.
Thank you, Madam Chair.
Thank you, Madam Administrator. With that, we will move on to the next item on our agenda, which is item number 12. This is House Bill number 6603, an act concerning a reduction in duplicative health inspections. This is a JF to the floor. May I have a motion?
So move.
Moved by Senator Anwar and seconded by Representative Claritas Tetria. This bill requires the DPH to study the requirements of the department's health inspection and determine whether any are duplicative. And is there discussion on this item? Seeing and hearing none, Representative Claritas Tetria.
Thank you, Madam Chair. I'd like to put this item on the consent calendar.
Seeing and hearing no objection, item number 12, House Bill number 6603 will be moved to our consent calendar. Next item on our agenda is item number 13, House Bill number 6604. This is an act expanding the breast and cervical cancer early detection and treatment referral program to include lung cancer screening. This is a JF to the floor. May I have a motion?
Second.
Moved by Senator Summers and seconded by Representative Berger Javala. And I will just say a few things and then go to Representative Berger Javala. This bill would expand the already existing early detection and treatment program for breast and cervical cancer to include lung cancer within existing appropriations. And I want to thank Representative Berger Javala and go to her for any comments.
Thank you so much, Madam Chair. Yes, so as you briefly explained, the Connecticut Breast and Cervical Cancer Early Detection Program, I won't bother with the letters on that one because I won't get those right, currently offers free exams to women 21 to 64 years of age who live at or below 250% of the federal poverty level, have no health insurance, or are underinsured. The idea of expanding this to include lung cancer is really inspired by the fact that lung cancer is the third most common cancer in the state, but also the most fatal, where more than twice as many die from lung cancer than any other cancer diagnosis. The only caveat here is we do not want to move this forward and add the lung cancer screenings if it means taking money from existing programs or from the Tobacco and Health Trust Fund. So that is the only concern, not only of myself, but of the advocates for this.
Representative Berger Javallo, thank you, and the advocates, not only for your work on this, but for explaining that to the committee. I think that's important. We know that this bill will require a conversation with our good colleagues in the Appropriations Committee. They hear from a lot of us, don't they? Senator Gordon.
Thank you, Madam Chair. I'm going to wear my doctor's hat on this one. I'm a cancer specialist. So if we can pick up cancers early, especially lung cancers, it does save lives. I can attest to that almost on a daily basis when I'm working in the hospital. So I do support this bill moving forward. And unfortunately, lung cancer has been one of those cancers that just gets overlooked because people say, well, we blame people because they smoke. Yes, 90-something% of lung cancers are due to smoking, but it doesn't mean we shouldn't be paying attention to what to do to be of help. And I'm glad to see that lung cancer more and more, at least in this state, and I wish other states would follow our lead, is being recognized that early screening makes a difference, and we should be following the appropriate guidelines that are out there and doing what we can do to help a lot of people in this state with the screening. So I do support it. Thank you, Madam Chair.
Thank you very much. Representative Clara Distria.
Thank you, Madam Chair. And I just like to reiterate what my other colleagues said. I think this is important for lung cancer screening, but I don't want to see money lessened in it with the breast cancer and cervical screening. So hopefully our friends in the Appropriation Committee will see the importance of that. Thank you, Madam Chair.
Thank you very much, Representative. Senator Summers.
Yes, I'd just like to thank the Connecticut Radiological Society. They're the ones who requested this bill and probably see this more than anyone. So I want to thank you for their forward thinking and requesting this bill be raised.
Thank you, Senator Summers. Senator Anwar.
Thank you so much, Madam Chair. I think this is a good opportunity for people who may not fall within this group, who we are trying to help out. But if you fulfill the criteria, you'll be in a high risk. Low dose CT scan of the chest can pick up lung cancers early enough that you can be cured of the lung cancer. And the word cure is sometimes not used frequently with the word lung cancer. And that's why this bill is very important. But the people who we are targeting in this bill, the ones who are outside of that group, even they can get it because the insurances now are covering the low dose CT scan of the chest. Thank you, Madam Chair.
Thank you. And though not exactly on this issue, I will take this opportunity to point out how many of the bills that we discuss at this committee are connected. We have had discussions about nicotine and flavor. We've had discussions about our regional behavioral health action organizations who help teach our young people to not start smoking. And it's together, collectively, hopefully we are making this impact. But specifically here today, thank you for the conversation about this screening opportunity. Representative McCarty.
Thank you very much, Madam Chair. And to go quickly, I just noticed in the language of the bill, there was a age limitation, and I'm wondering if that could be looked at because, and as the good doctor mentioned, I think a lot of the diagnosis comes also with a later age. So I just wouldn't want that to interfere with the screening, if that could be looked at.
Representative McCarty, I want to thank you for raising that. The original program, the original screening program had an age and gender focus. And as we looked at this bill and pondered whether we would JF this or JFS this, we realized that expanding the age would also be pretty clearly expand the cost. And because of those concerns that we've talked about in terms of addressing the cost, we did not make changes to the language. But what your point is very well taken and clearly very important as we go forward. In a sense, we are almost creating another screening program. And so that's something we absolutely have to think about, that age matters. Senator Gordon for the second time.
Yes, I'll be real quick. Thank you, Madam Chair. I just want to say when it comes to lung cancer screening, they're a well-established age. and also smoking history criteria that's established in the science of the studies such as LCAP and many others that led the way to get lung cancer screening where it is today. So whatever ages we look at, those are already well defined and in defined protocols. I can tell you when we order lung cancer screening, those are very well on our checklist, who qualifies, who doesn't. So that work's already done. But thank you, Madam Chair.
Thank you. Thank you very much for this discussion. Representative Cavros-Degrelle, did you have a question? No? Okay. Is there any other discussion on this item? If not, Representative Clara DeStitria.
Thank you, Madam Chair. I'd like to put this item on consent.
Seeing and hearing no objection, item number 13, House Bill number 6604 will be added to our consent calendar. And that takes us to item number 14. This is House Bill number 6672, an act concerning endometriosis. This is a JFS to the floor, LCO number 5186. May I have a motion? Representative Gilchrist, is there a second? Second, Representative Kennedy. And I would like to begin by thanking Representative Gilchrist and Representative Kennedy for their leadership and others. I believe Representative Cavros-Degrelle, and am I forgetting anyone? You'll help me. Representative Berger-Jaballo, members of this committee and the members of the community who bravely shared their stories with us and have helped to educate us. There is JFS language for this bill. You may recall in testimony we heard from the nurses. We are not going to be pursuing that aspect of the bill. Instead, we will be focusing on the biorepository. So essentially sections 1 and 2 of the bill are no longer a part of the bill. The creation of the biorepository will be working with UConn Health Center in collaboration with an in-state research lab to do a number of things, data collection protocol, curating biological samples, raising awareness, serving as a centralized resource for information, facilitating collaboration, collecting information on the impact of endometriosis on our residents, and then also very importantly, applying for grants, something we all love and appreciate very much. It will, in addition, create, this is the S language as well, it will create an endometriosis data and biorepository program oversight committee as well. Is there discussion on this item? Representative Gilchrist.
Thank you, Madam Chair, and thank you to the entire committee. It was a very moving public hearing. As you all heard, many individuals who experience endometriosis don't feel heard. And so for them to have a space to come and share their experience and just really get the feedback from all of you, and then to have this bill be moving through the committee, just thank you. And I do think that this is the start of something really big for the state of Connecticut and this country, in that this disease still doesn't have any diagnostic tools or treatment. And so we really can be a leader here in the state and across the nation. So thank you to Representative Kennedy and Cavros-Degrelle and Berger-Jaballo and to all of you for moving this forward. Thank you.
Thank you, Madam Chair. And I just want to thank Representative Gilchrist. This is a committee, a working group that we started working in September of 2021. So we did a lot of work. We heard a lot, and it was quite eye-opening. And it was really a great group to give women a voice when they're not being heard on something that's so easily dismissed. And it's kind of like take an aspirin or go get some rest and you'll be fine. So it was really an honor to be a part of this group, and I look forward to supporting this. And I'm going to do my 10-second. I hope everyone is signed up for the documentary Below the Belt, which is going to be held next Tuesday, March 7th. It starts at 4:00 and it's at Jackson Laboratories. Thank you for the indulgence, Madam Chair.
Thank you, Representative Kennedy, and I appreciate that and appreciate very much the learning that we all were able to have as part of this conversation. And I certainly was surprised to learn that 10% of our female population, 10%, 1 in 10 women are impacted by this. So it's a pleasure to be able to vote on this today. If there's no other discussion on this item, Representative Clara DeStitria.
Thank you, Madam Chair, and I'd like to put this item on the consent calendar.
Seeing and hearing no objection, this item will be moved to our consent calendar. Speaking of our consent calendar, that is now properly before us, and I will. We have we have had a motion and a second already previously, so I will review those items that are on consent before we vote on the consent calendar. So item number 4, Senate Bill 957, an act concerning the oversight of healthcare and correctional institutions by the Department of Public Health, JF. Item number 5, Senate Bill 958, an act concerning the timely transfer of medical records between healthcare institutions, JFS LCO 5405. Item 6, Senate Bill number 959, an act establishing a mold protection advisory council to recommend protections for residents of residential property from mold infestation, JFS LCO 5183. Item 7, Senate Bill 960, an act establishing a working group to evaluate emergency department crowding, JFS LCO 5165. Item 9, House Bill number 6599, an act concerning intimate partner violence and other domestic violence, JFS to the floor, LCO 5075. Item number 10, House Bill 6600, an act concerning funding for regional behavioral health action organizations, JFS to appropriations, LCO 5334. Item 12, House Bill 6603, an act concerning reduction in duplicative health inspections, JF to the floor. Item 13, House Bill 6604, an act expanding the breast and cervical cancer early detection and treatment referral program to include lung cancer screening. And finally, item 14, House Bill 6672, an act concerning endometriosis, JFS to the floor, LCO 5186. And with that, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Grady,
Representative McCarthy Vahey votes yes.
Senator Kushner. Senator Kushner votes yes. Senator Marks,
Marks votes yes.
Representative Parker,
Representative Parker votes yes.
Senator Summers,
Senator Summers votes yes.
Representative Clara DeStitria,
Representative Claire DeStitria votes yes.
Representative Burger Givallo,
Representative Burger Gervalo votes yes.
Senator Cabrera,
Senator Cabrera votes yes.
Representative Carpino,
Representative Carpino votes yes.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné,
Representative Dauphiné votes yes.
Representative DiCaprio,
Representative DiCaprio votes yes.
Representative D'Amico,
D'Amico votes yes.
Representative Denning,
Representative Denning votes yes.
Representative Elliott, Representative Foster, Representative Jenga,
Representative Jenga votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Gordon,
Senator Gordon votes yes.
Representative Cavus DeGraw,
Cavros DeGraw votes yes.
Representative Kidd,
Representative Kitt votes yes.
Representative Kennedy,
Kennedy votes yes.
Representative Lenahan,
Linehan votes yes.
Representative Mara,
Representative Mara votes yes.
Representative McCarthy,
Representative McCarty votes yes.
Representative Palm, Representative Perrello,
Perillo votes yes.
Representative Rader,
Representative Rader votes yes.
Senator Rahman, Representative Reddington Hughes,
Representative Reddington Hughes votes yes.
Representative Ryan,
Representative Ryan votes yes.
Senator Slack, Representative Steinberg,
Representative Steinberg votes yes.
Representative Terciak, Representative Wielander,
Representative Welander votes yes.
Representative Zupkis,
Representative Zupkus votes yes.
Representative Elliott, Representative Foster, Representative Palm, Senator Slack, Representative Tercia. Thank you, Madam Chair.
Thank you, Madam Administrator. And as we get ready to recess, because we will keep the votes open until 5 p.m. today. As we get ready to recess, I want to again thank the incredible team who they're the ones who allow us to move all this work forward, including Beverly Henry and all of the administrative team and our nonpartisan team as well. We do have a public hearing. That is the next time we will gather. It will be on Monday. We will begin at 11 a.m. We have a robust agenda. I'll remind you, we have 2 other public hearings scheduled for the 13th and the 22nd. I don't have the committee meetings off of the top of my head, but I will offer Senator Anwar any closing remarks.
Thank you, Madam Co-Chair. I completely agree with you. We can't do this without the team. While we looked at some of the bills today and we spoke about them, and it took us perhaps about 1 hour or so to discuss some of these bills, or hour and a half. Every bill took multiple hours of conversation, and it took many, many more hours for our LCOs to draft it. So there's so much work that goes on behind the scenes for the co-chairs, the vice chairs, and our ranking members when we are looking at the bills and reading the details and looking at how we can make them better. And then the LCOs working on this, and the Office of Legislative Research doing the background work. It truly is enormous amount of work. And I just wanted to thank each and everyone in this process to try to do the best thing for our citizens with the resources and the capacities that we have. So thank you, Madam Co-Chair.
Thank you, Senator Anwar. And with no other comments, we want to thank you all and wish you a wonderful weekend. And Public Health is in recess until 5 p.m. Oh, whose is this? A joint.
Madam Administrator.
Hello. Okay, you're good on the consent calendar, so we don't have to do that one. The first roll call was on proposed bill 5902, an act requiring food allergy awareness in restaurants. Let me do a different screen here. Hold on. Representative Cabras de Graaf, how would you like to vote on that bill?
Yes. Yes.
Senator Kushner, how would you like to vote?
Yes.
The next bill was Senate Bill 919, an act establishing a task force to study childhood and adult psychosis. Representative Cabras de Graaf, how would you like to vote?
I can't quite hear you, but I'm a yes.
Senator Kushner, did you hear me?
Yes, I did. I'm a yes.
Thank you. Senate Bill 956, an act requiring discharge standards regarding follow-up appointments and prescription medication for patients being discharged from a hospital or nursing home facility.
If you can hear me, yes.
Senator, how would you like to vote? Oh, you voted on that one.
Oh, I did vote. So then I think I voted on the rest of them, right?
I am going to take a quick look.
I think I just missed the
Yes,
first.
you did.
Yeah. Thank you. Have a good weekend.
Same to you. Representative Cabras de Graaf, House Bill 6562.
Yes.
House Bill 6601, declaring homelessness a public health crisis.
Yes.
Thank you.
Is that it?
Yes.
Okay, thank you so much.
Hi, Senator.
Hey, how are you?
Good. Do you have your agenda in front of you or no?
I do not. Do you need me to?
Yes, if you can pull it up, so you will see the ones on consent.
Okay, is that in the calendar invite?
What was that?
Is that in the calendar? Is that,
Kate Hamilton sent out an email last night.
yeah, give me 1 second and I'll have it.
Okay, great. Thank you.
Okay, I have it now.
Okay, I'll give you the ones that are on consent. Senate Bill 957.
Yep.
Senate Bill 958. Senate Bill 959. Senate Bill 960. House Bill 6599. House Bill 6600. House Bill 6603. House Bill 6604 and House Bill 6672. Those are all on consent. How would you like to vote?
Vote yes.
Thank you. It's the first section of the bills to be drafted as vote to draft bills. Item number 2, House Bill 5902. That's a roll call. How would you like to vote?
Yes.
Item number 2 on the bills to be considered for JF action, Senate Bill 919. That's a roll call. How would you like to vote?
Yes.
Item number 3, Senate Bill 956. How would you like to vote?
Yes.
Item 11, House Bill 6601. How would you like to vote?
Yes.
And I skip one. Item number 8, House Bill 6562. That's a roll call as well. How would you like to vote?
Yes.
Thank you.
Thanks so much. Have a great weekend.
Same to you. Bye-bye.
Bye.
You gotta pay. Sorry, Dan.
Oh. You can cause trouble anytime. You're one of my favorites. Yes, sir. Make sure you bring food. I don't know what the setup is gonna be like, but you know by Sunday evening. Roll call.
I only think. Right. Yeah, because then I can.
Yeah.
Okay, thank you. I hope you get a little time to yourself.
You don't start thinking.
I know.
We don't
I
get
know.
time. Who's the Senate chair? Yeah.
I have a. Oh.
In education. You're still in education. Is it still McCory?
Public health.
No.
So, yes.
Doug McCory is still there? Oh, that is crazy.
I
I love him, but yeah, that'd be crazy.
It'll be a dull moment. All of a sudden he's there.
He just perks up.
Yeah.
And gets loud.
Thank you, Deborah.
Yep. Thank you. This is rough work. Oh. Good. I feel someone 3 more. Who's the next one? I heard you. I'm coming. I have to get. Okay. It wasn't that bad. It wasn't bad at all, no. Oh Lord, have mercy. Counselor? Huh? I'm right there. Yep. Yep. I don't know, I think I'll find it. The kids are still in the building? I saw like a bus or
Representative Elliott, how are you?
How's it going? Oh, you can't hear me?
Me. To me, I turned the volume down when I was in the conference room, in the hearing room, and I didn't turn it back up. How are you doing?
I'm doing great. How are you doing?
Excellent. Thank you for asking. So we've held the votes open, and I'll start with
Hey, hold on
item
one
number-
second.
Sure.
She's super friendly. Give me 3 seconds. Come on in.
Absolutely.
All right, Kate. I'm ready. I'm ready for you.
Okay. Item number 3, sub-item number 1, proposed Senate Bill 524, an act establishing a pilot program for cardiac screening and early detection of cardiac issues. We did a voice vote on that.
That's a yes.
Okay. And then the next one, item 2, was proposed House Bill 5902, an act requiring food allergy awareness in restaurants. And how do you vote
Yep.
on that?
Yes. Oh, sorry. You got it.
Okay. And then section 4, item 1 was no action today. So then we moved on to number 2, Senate Bill 919, an act establishing a task force to study childhood and adult psychosis.
Yes.
Okay. And then the next item, Senate Bill 956, an act requiring discharge standards regarding follow-up appointments and prescription medications for patients being discharged from a hospital or nursing home facility. And how do you
Yes.
vote? And then item number 4, which is SB 957, number 5, 958, 6959, 7 SB 960, we're all on a consent calendar.
Mhm.
Okay, and then 6562, item number 8, House Bill 6562, an act concerning telehealth. How do you vote?
Yes.
Okay. And then the next items, number 9, HB 6599 was on the consent, as was 10 HB 6600.
Yes.
And then HB 6601.
Yes.
Yes.
I'm going to be a yes on everything, Kate.
I have to read them out loud to you though.
I know. I know.
HB 6603 and HB 6604 on consent, as was HB 6672. So on the consent calendar were SB 957, 958, 959, 960, and House Bill 6599, 6600, 6603, 6604, and 6672. Rep. Elliott, how do you vote?
Yes.
Excellent. Thank you so much. I appreciate it.
Thank you, Kate.
Have a good weekend.
Bye.
Hi, Rep. Foster. How are you?
I'm great. Thanks, Kate. How are you?
I'm good. Okay, so let me So let's see. So
The consent calendar was being made when I left. Yep.
So 956 was the last vote I had from you. So then the next item was item number 4, 957 was on the consent calendar. As was Senate Bill 958, Senate Bill 959, Senate Bill 960. Then we got to House Bill 6562, which was item number 8. And that was an act concerning telehealth. And Rep. Foster, how do you vote on that?
Rep. Foster votes yes.
Then item number 9 and 9 and 10 were both on the consent calendar. Item number 11, House Bill 601, an act declaring homelessness a public health crisis. And how do you vote on that?
Rep. Foster votes yes.
And then HB 603, 6604, and 6672, all of the consent calendar. So, there are 9 items on the consent calendar. Would you like me to read those to you, or do you know?
Nope, I followed them. Rep. Foster votes yes on the consent calendar.
Excellent. You're all set. Thank you so much. Hope you have a good weekend.
Thank you.
Bye.
You too.
And there, I think I got everything.
Hello, Rep. Tersiak. How are you?
Hanging in there. You know, everything's at least as well as can be expected. How are you?
I'm good. I'm very good.
Very good. Thank you.
Thank you. So we have, I have a lot of reading to share with you today. So I will start with,
actually, I followed along. I just had it checked in to be interactive.
Perfect.
So,
Okay. So I'll
it's-
just,
so
I'll
it's,
just,
it's a consent calendar, read what, titles or not, because I'm a yes.
okay, so I'll start with, the first item on, proposed Senate Bill 524, an act establishing a pilot program for cardiac screening and early detection of cardiac issues. That was on a voice vote.
Okay, I'm a yes on that.
Okay, and then, number 2, proposed House Bill 5902, an act requiring food allergy awareness in restaurants. How do you vote on that?
I'm a yes on that.
Okay. And then there was under section 4, bills to be considered for JF action. There was no action on the first item, SB 899. Then on SB 919, an act establishing a task force to study childhood and adult psychosis. How do you vote on that
I'm
bill?
a yes vote on that.
Okay. Then 956 is the next one. An act requiring discharge standards regarding follow-up appointments and prescription medications for patients being discharged from a hospital or nursing home facility. How do you vote on that?
Representative Tertiak votes yes on that also.
Thank you. Okay. And then that one, the next 4 are on a consent calendar until we get to, where did it go? Item number 8, House Bill 6562, an act concerning telehealth. And how do you vote on that?
I vote yes on that.
All right. And then we go back to the consent calendar until we get to item number 11, House Bill 6601, an act declaring homelessness a public health crisis. And Rep. Tertiak, how do you vote on that?
I vote yes on that.
Thank you. And then 6603, 6604, and 6672 are also on the consent calendar, so that we have 9 total items on consent. And Rep. Tertiak, how do you vote on that?
I vote yes on the consent calendar, please.
Excellent. Thank you so much. And
Oh,
you're all
thank you
set.
so much. I
And I hope you have
appreciate it.
success.
Okay, thank
Okay,
you. Bye-bye.
bye. Can you watch this? I just need to go over. Why is that now? You're right. Let me turn that off. It's because I don't want people to see. All right, what I'm doing. You got. Okay, Rep McCurdy, we on the agenda, item number 3, subsection number 2, proposed House Bill 5902, an act requiring food allergy awareness. How do you vote? Oh, yes. Great. Thank you so much, Rep McCurdy. Appreciate it. Thank you very much.